I am Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And thank you all for joining us this afternoon. We'll spend a little bit of time talking about the Elder Index and economic security. So the first thing that I would like to briefly mention is that the Elder Index was developed a couple of years ago by the Gerontology Institute at the University of Massachusetts in Boston. The purpose of this tool is basically to try to take a look at how much money does it take to live in a particular county in the United States. It tries then also to look at that along several different variables, including the size of your household, whether you own or rent, a little bit about health status, and then some of the other costs that we all face as we have to run our daily household, whether we are a renter or whether we are a homeowner. So in 2023, the average Social Security for an older adult in Colorado is $1,825 a month, or approximately not quite $22,000. Now, I want you to remember that number because we're going to be looking at a couple of charts as we go through some of the following slides. The other thing that's absolutely critical and important as we're looking at economic security is that 40% of Coloradans live on only Social Security. So if the average Social Security is $1,825 a month, or a little less than $22,000 a year, and 40% of Coloradans, that's their only income, that represents around 300,000 people. So this is a pretty significant number or group of people in our community. So the one thing I decided to do as part of this presentation is to use this Elder Economic Index and to look very briefly at if you were a renter, not a homeowner, but a renter in 2023 in 3 communities in Colorado, what would that cost? So if you were living in Denver, you would need $32,000 a year. If you live in Pueblo, you need $25,000 a year. If you live in Montrose, you need $26,000 a year. I ran these numbers for several other communities as well. And if you live in like Crowley County, you can just about make it if you have $21,000 a year or $22,000 a year in Social Security income and you're a renter. It's also important as you look at this that rent is the biggest variable. But the other thing that we noticed is that as you live outside of the metropolitan areas, it's also more costly for health insurance, even for older adults, regardless of where you live. There's some variation as well in terms of transportation. So these are the costs, if you will, that you look at in terms of if you are a renter. If you are an individual then with a homeowner with a mortgage, and these numbers seem somewhat low, but my guess is that we are looking at mortgages that are have been in place for a while, rather than mortgages that have been maybe put into place in the last 5 or 10 years. So a homeowner with a mortgage, you're looking at Denver about $1,800. That's probably a principal and interest payment and not taxes and insurance is my best guess. It does not say that in the tool that we're looking at in this Elder Index. If you're in Pueblo, you're looking at $1,150 mortgage. If you're in Montrose, you're looking at $1,366. Again, the variation in terms of the Other costs pretty much remain the same. But if you are, as I said, a homeowner with a mortgage and you're only making $22,000 and the average amount that you need is $37,000 in Denver, 30 in Pueblo, and 33 in Montrose, it's going to be extremely difficult as an individual to actually make those payments. Now, the next variable that we looked at a little bit is if you are a homeowner without a mortgage. This is really probably the best position, if you will, to be in at this point in time. In Denver, without a mortgage, you're looking at around 22.6, so you're almost even. In Pueblo, 21.9, again, so you're almost even, as well as in Montrose. So there's probably a little bit of variation that you could manage on a single Social Security income if you were a homeowner and you did not have a mortgage and all you were paying was for things like utilities, taxes, insurance, and those kinds of things on your home. If you're in one of those other categories, obviously you're going to be experiencing a big disparity between what you have in monthly income and what you have to pay, what your bills are. So the next thing I tried to take a look at is who is at greatest risk. And basically there are a single individual, obviously because you're only living on one income, unless you have pretty significant savings or other type of retirement income. The older women get, the more likely they are to also experience less monthly disposable income or income just to meet their basic needs. Women who are people who are living on Social Security alone, and people who are experiencing high medical bills. Again, those are the people who are most likely at risk. So one of the things I decided to take a little bit of a look at is where are some things that we might be able to save money. And again, all of us like certain things, but there are a few things that we might be able to do. So in this particular graphic, we could save $140 a month or about $1,600 a year if we cut out some unnecessary purchases. And some of you may already be doing some of these things, but the first one is eating out and or ordering takeout. Again, that tends to be a very expensive expensive habit, if you will. I think some of us got very used to, again, during the pandemic, not necessarily eating out, but we substituted ordering in or takeout for that. And that is just as expensive, if not more expensive, than eating again at home. Another thing that many of us do is look at needless groceries. So what are groceries that we might be purchasing that we don't necessarily need? So are we buying extra sauces? Are we buying extra spices that we might only use once? What are the kinds of things that we might do without? In my own world, one of the things that I would have to make a big decision about is I love milk. Milk is about $4 a gallon. If I was not drinking as much milk as I like to drink and I substituted water, I could in fact save a certain amount of money. Another thing that many of us do is online shopping. Online shopping tends sometimes to be very expensive, especially if we are paying shipping charges. So I went to order an item for a chair mat for my office the other day, And if I pick it up at a local supplier in Denver, I can get it for free. If I have it shipped, it was going to cost $156, which was more than the item itself. So again, shipping charges tend to be very expensive if we are doing online shopping. The other example that I would provide for you, and I don't know exactly how much I could have or would have saved had I opted to go this route, is that at Christmas time when I was ordering gifts, I got really used to the free shipping during the pandemic. This past year at Christmas, unless I met a certain minimum of $35 or $45, then I had to pay a $15, $20, $30 shipping charge. So I was actually buying more expensive gifts because I could get the free shipping. If I was purchasing those at the retail store and then wrapping them and putting them in the mail, I really don't know what the savings could have been, but there probably was some there.
Yeah, that was.
Another thing to look at is alcohol. How much money do we actually spend on alcohol, and is that a necessity?
No.
Alcohol can be very expensive, especially if we are purchasing at a liquor store, if we are having it delivered, that again adds to the price. Another thing that we need to look at is what are those items that we don't really need. And sometimes, again, it might be very nice to have a new set of towels for my bathroom, but do I really need a new set of towels, or does it just make me feel good that I was able to buy a new set?
Yeah.
Area where we need to pay attention in terms of expenditures is food costs. So 37% of individuals 50 to 80 say basically that food costs impact them a lot. So if you are in fair or poor mental health, eating healthy is basically costs you 58% more versus 54%. Again, when you compare these across, what you find is that the less income you have, the less healthy that you're probably going to be living. If you have a lower education, you may also eat less healthy. So again, food costs can have an impact, but eating less healthy is not necessarily a way to go, but often an area where people try to save money. These next couple of slides take a look at where do we spend money unnecessarily. Again, this is one of those areas that I put in the category of pleasure. So if I buy out a cup of coffee at Starbucks, and I do this 6 times a month, then I could save an average, if I didn't do that, of approximately $300 a year. Now, again, if we look at a homeowner who has Social Security only and owns their own home, $300 gets us closer to that projected break-even point. If we're a homeowner with a mortgage, we have to look at many different ways that we can save money. And if we're a renter, we have to look at many different ways that we can save money. This is just another way to look at eating out coffee, again, store-bought versus home brew. This one actually looks at it on a price per cup. So if you make it at home, they suggest that it costs you 25 cents a cup. If you buy it out, it's $1.85. So over a year, again, you could save almost $1,000, $1,500, depending on how many cups of coffee that you eat. Sometimes I see people say, well, it's only a cup of coffee. It's not very expensive, so I'm going to treat myself. And it's not that I'm suggesting that people should not treat themselves. I'm just merely trying to point out that sometimes these small pleasures do in fact cost us money. And if we're very much on the edge, these are little ways that we could save money. So an example or an alternative might be if you want to meet a friend for coffee and it's 25 cents a cup, make it at your house and then invite a friend to come over to have coffee in your living room, as opposed to meet you at a coffee shop. Another thing that I took a look at a little bit was healthcare costs and retirement. This is a pretty frightening statistic. I'm not very familiar with Healthy View, but basically what they suggested is that in 2017, a 65-year-old couple, so this is two people, would pay $11,000 in costs if you had Medicare. And by age 85, that same group of people are spending almost $40,000. And these numbers are pretty significant because, again, if you take the $166 times 2 of the Medicare Part B premium, you're looking at about $330. If you have a traditional Medicare, so you have a Medicare supplement at age 65, your monthly premium for your Medicare supplement is probably around $150 a month. So that would be $6,000. If you have a Medicare supplement and you are age 85, that Medicare supplement is probably costing you $350 a month. At $300 a month, you would be up to $3,600 a year per person, times 2 is $7,000. That doesn't include any medications then, any fees for your Medicare Part B, Part D, or any out-of-pocket costs that you might have. And most likely this also includes any over-the-counter medications or non-reimbursed Medicare benefits, such as maybe massage or any type of physical therapy or exercise classes. Another interesting thing to look at as one tries to plan is the healthcare costs for Medicare beneficiaries specifically. Fidelity Investments did a study. This is a 2022 study, and they looked at retirees, again, who retire with traditional Medicare coverage. And over your lifetime, you could expect to spend approximately $315,000 on copays, deductibles, insurance premiums, and other expenses not necessarily covered by Medicare. So if you are doing planning related to how much money do I need for health care, that's a pretty significant number. If you're a single person, if you're a couple, obviously that is going to double. Again, those numbers, if you will, are a little bit higher than what was in that Elder Index when we looked at it, depending on which community you lived in. So these, again, this is a Medicare supplement. This is not necessarily a Medicare Advantage. Some people do find that they can save money with a Medicare Advantage on monthly premiums, but if they become a high utilizer of Medicare benefits, then this year I believe those are capped at around $7,500 or $7,800. So again, you're looking at like $16,000 for a couple. I also thought we needed to take a look at, as part of this discussion, what are the costs of long-term care in Colorado? This is an annual study that is presented by Genworth, which is a long-term care insurance company that has been selling products in Colorado for many years, and also producing this particular set of comparisons in terms of costs of long-term care. So annually, if you were to hire a homemaker or a home health aide to come into your home, you're looking at between $6,300 and $6,800 per year. That is, again, not a full-time person in any way, shape, or I'm sorry, per month, not per year, per month. That is not necessarily a number that is small, but it does allow you to stay in your own home. If you use adult day services, you're looking at on a private pay around not quite $1,950. If you're doing assisted living, you're at $4,750. Again, those numbers are basic services only in the assisted living and the adult day programs. Most of those programs have what they call, or some variation of a level 1, 2, or 3. And then they will charge more depending on the level of service that you need. So this is a basic fee. Usually, this is not an all-inclusive fee. If you're looking at care in a nursing home, you're looking at between $8,500 and $9,700 for a private rooms, $8,500 for a semi-private room. Again, if you have assets and are paying for those privately, those are pretty significant numbers and not included in those numbers that I gave you earlier on the Elder Index, because those individuals I primarily had in good health and living in the community. In 2021, the median cost for someone living in a private room in a nursing home was right at $108,000. I believe that that number is up a little bit. We are currently doing in our office our annual calls to nursing homes to be able to identify what some of these charges are. And I'm going to guess that we're going to be a little bit higher than that. So we're looking at economic security as we get older, is what happens if a spouse passes away. So the most important thing that happens to people is that your Social Security is going to decrease. You are going to go from one check to, or from 2 checks down to 1 check. So in my situation, if depending on who the larger spouse, which spouse receives the larger amount of Social Security, so you will lose the one that is lower. So if I make more money than my husband makes and I die before he does, then he would get my Social Security, which would be more than, if I make more than he does, then mine would be higher. For some people, pensions may also change, again, depending on whether or not there's a spousal benefit involved. Sometimes you have the option where it's a level payment, regardless of if one spouse or 2 spouses are alive, or if it's your own independent pension that comes off of your record, but pensions change as well. Sometimes, depending again on the size of life insurance, some people have minimal life insurance, meaning that they have enough life insurance that can bury them. Others will have life insurance that has a much larger payout, $100,000, $200,000, $300,000. And sometimes people buy larger insurance policies with the specific intent that that will provide for lost income when one spouse passes away, as opposed to having 2 incomes, whether that's through Social Security or other pensions. Other changes that one might see is your Medicare and healthcare costs obviously are going to decrease. You're only paying for one Medicare Part B premium, one Medicare Part D benefit, for one Medicare supplement or Medicare Advantage and the associated healthcare costs. Food costs probably will decrease some, but maybe not a lot, depending on, again, what you tend to Transportation costs may also decrease, especially if you're a household with 2 cars as opposed to 1. You may not need 2 vehicles. You may travel less. You may go out less. So there may be some decrease in that. The area where we saw in terms of the economic index that remained pretty static was housing. And that was also the big cost. So again, that's probably not going to change. Your rent is going to be $1,000 a month, whether there's one person in your apartment or 2. Similarly, your taxes and insurance, if you own your home without a mortgage or with a mortgage, those payments are not going to change. So the next thing I decided to do was take a brief look at what are some of the policies that Colorado is currently doing that can help older adults. So this year, this is a one-time only at this point in time, there is something called the Senior Income Tax Credit. This is $1,000 that an individual who either rents or does not claim the senior homestead exemption and makes $25,000 or less is entitled to. If you make between $25,000 and $75,000, you can still get this credit if you don't claim the homestead exemption, but you will get a lesser amount. And say, for example, your adjusted gross income is $50,000, then you would get $500 from the senior income tax credit. If you file for taxes, so you have to file federal income tax, a 1040, as well as state income tax, you should then get that refund or that tax credit, which if you don't owe the state of Colorado any money, would come back to you in the form of cash. Works very similar to the earned income tax credit for young families. If you owe taxes and you haven't paid them, then it comes out of this income tax credit. If you have paid all the taxes that you owe, or you didn't owe any to start with, then you would get the full amount. There is a large group of older adults in Colorado, especially this group that is living on Social Security alone, whether they're in their own homes, whether they're in an apartment, whether they're in subsidized housing, assisted living, or a nursing home, doesn't matter. All of those individuals are eligible for this senior income tax credit. And individuals who are non-filers are not automatically getting this tax credit. They have to file the Colorado income tax forms. You have to file the DR0104, as well as a second form called a DR0104CR. If you have questions about that, we can put those numbers in the chat. You're also welcome to call our office if you have any questions or you need any assistance. Another thing that is happening this year and has happened for the last couple of years, expected to happen in the near future, is that Colorado also, Coloradans are eligible for the TABOR refund. A lot of people, again, who are non-filers do not necessarily automatically get this TABOR refund. So if you are not somebody who has to file income taxes, be sure that you file those same forms to claim your TABOR refund. If you're relatively low income, and your annual income is around $16,000, you may also be eligible for the property tax rent heat credit. This can be up to approximately $1,000 per year. The minimum amount is around $360 per year. You file a different form with the state called a PTC 104, but a large number of older adults do not take advantage of this tax credit either. So if you know people who are in those income tax brackets, please encourage them to take advantage of it. For those of you who are homeowners or your family or friends are homeowners, if they have lived in their own home for 10 years or more, they can get a 50% exemption on the first $200,000 of value on their property taxes. So that amounts to between $500 and $800 per year, again, on a reduction. If you've owned your house less than 10 years, you are not eligible for that exemption, but this year you would be eligible for the senior income tax credit. So make sure that you take advantage of that. That people can do in terms of looking at how to increase income during retirement. A really big and important one, if your health will allow, is to continue to work until age 70. The significant amount or difference in your monthly Social Security if you work until age 70 is pretty significant because it increases something like 7 or 8% from age 66 until age 70. So that's a pretty big number. And that, again, can help, if you will, to make your economic security, if your Social Security is your only source of income in retirement. For those individuals who are working either past age 70, either in their current employment or different employment, there is a lot of effort at this point in time in a lot of different industries at focusing on hiring older workers. So especially in the healthcare industry and the retail industry, there's a lot of focus on hiring older workers. The airport, I was in the airport yesterday and was very surprised at the large number of older workers who were working to help people. Even the couple of the flight attendants were older, but even those individuals who were working like the desk and the check-in and maybe not so much baggage claim, but basically helping around. So again, getting very creative about where older workers can be employed. There is a bill in the current legislature because there is some sense that there is quite a bit of age discrimination going on. So this particular bill basically would allow potential, or I should say prohibit potential employers from asking age at the time when you actually submit the original employment application. Eventually, if you get offered the position, or if they make you a job offer and you have an in-person interview, and the employer may at least get some idea of how old you are. And eventually, if they offer you the position and they have to do things like security checks, set you up for payroll deductions, those kinds of things, then they usually are going to ask for some kind of proof of lawful presence and or legal identity. And at that point, they would know your age. And that would continue to stay perfectly legal. What the bill is currently attempting to do is to make sure that a potential employer does not say, I am not hiring this person because they're over the age of 40 or 50 or 60. And when we identify employers with that perception, what we are able to see is that many of them have the assumption that many older adults are sick, that they have a high level of absenteeism, and that they will not be necessarily able to learn new skills, and that will be a drag, if you will, on their workforce. Currently, there is also a policy, a state statute that requires that if you list a job, you have to put the pay range or the salary that you are going to be paying. Again, this is an attempt by the state of Colorado to avoid paying older workers or other individuals less than you might be paying for somebody who might be in their earning high wage earning days. So again, it's a way to level it out and to make sure that you're getting equal pay for equal work, regardless of your age. Of other policies for Medicare and healthcare costs that you may or may not be aware of, because we're looking at the such low, if you will, annual income for individuals who live on Social Security alone. And if you remember, the average Social Security for Colorado was $1,849 per month. So Medicare Part B does offer, under the Medicare Savings Program, these three programs: the QMB program, the SLIMB program, and the QI1 program. If you have monthly income under those amounts, if you are in the QMB program, they'll pay your Medicare Part B premium, as well as your copay and deductibles for Medicare. If you're in the other two programs, it will pay your Medicare Part B premium, but not any of your deductibles and copays. And that, is, as I indicated earlier, $166 per month. Do have to meet the resource requirements as well to take advantage of this program. So for a single person, it's $9,900. For a married couple, it's $15,600. This excludes a $1,500 burial allowance as well. Medicare similarly has a program that can help individuals if your income is lower with the Medicare Part D premiums, and as well as your copays. So if your monthly income is less than basically $1,700 as a single, $2,289 as a couple, you can qualify for, if you purchase a participating plan, a Medicare Part D plan that has no copays, and they will help with some of the out-of-pocket expenses as well. Again, you have to meet the resource requirements, so $14,790 for one person and $29,500 for a married couple. I forgot to mention that if you think you qualify for the Medicare Savings Program, you would apply through the County Department of Human Services. This prescription drug benefit, you would apply through the Social Security Administration for this benefit. Because when we looked at long-term care costs and how expensive those are, I thought if you are faced with needing long-term care services, Medicaid is an option as well. There are two programs, the Home and Community-Based Services Program, as well as long-term care or support in a nursing home. So again, the income requirements are $2,742 for an individual. And if you are as a single person, you can only have $3,000 in resources. If you're a couple, you can have that resources go up to $148,620. And if you are again, if you own like a house, that house it can be considered exempt, and the value of your house cannot be more than $688,000. The exempt resources, basically, in addition to your house, is a car. And if you have any dependent children living in your house, or if you own your house in joint tenancy with a sibling, or you have an adult child who lives in your house and that helps to avoid going to a nursing home, those are the exemptions, if you will, for Medicaid. It's much more complex and complicated, but if you think you might be eligible and need these services, feel free to give us a call. And so those are some of the programs, if you will, that can help with improving your economic security. Feel free to give our office a call if you have any questions. So the next two slides are just briefly going to cover a little bit about the programs that we offer in our office. So we do have grants for vision, hearing, and dental services. For vision and hearing, you have to live in the Metro Denver area. For dental services, if you live in the Metro Denver area or if you live on the Western Slope. Our Telephone Buddy program matches volunteers with older adults who would like to receive a call once or twice a week to check in on their well-being and their self-worth. We can help with Medicare and Medicaid counseling, general counseling and referral. We have an online resource called our Housing and Home Care Locator. There you can search for housing and home care resources, including home help in the home, adult day programs, hospice programs, assisted living, nursing home, independent living, and low-income housing. It's a complete listing of all of the programs in the state of Colorado, and it gives you quite a bit of information. You can get that at our website at senioranswers.org. We also provide a holiday basket project for older adults who live in the Metro Denver area. We're going to be offering our Salute to Seniors this year on May the 20th in person and on May the 21st on Zoom. And more details will be posted shortly on our website. You could check out our website at senioranswers.org, and there's a vast amount of information there. In the fall, every year, we do our Medicare Monday series. We will probably do some of those this year in person, as well as some online or virtually again. This is basically information about changes for the upcoming year. So next year will be 2024. We do a lot of public benefit counseling. We do this aging in place educational programming, as well as other consumer education programs. And we do some professional education. And that concludes our remarks for the day. Thank you all for joining us. And I see that there are a couple of items in the chat here. And I guess one person just says she loves the detail. Thank you. And let me know if you need more detail, because my sense is that people really have to have the details to make sure that the programs are going to work for them. And obviously, in a short presentation like this, I can't go into all the detail. So we're happy to do that either with a phone call or an in-person interview, if that makes sense for you, or a Zoom interview. And the next individual wants to know if there is a way to either replay this or a copy of the slide deck. And we will send the recording out as well as the slide decks to all of the individuals who register. We will also post this on our website, on our YouTube channel, which is capital C, capital O, Gerontology, and you can view it or encourage your family and friends to view it as